Welcome, welcome, welcome. I am so honored to be here with Richard Ekeke. I am Dr. Ali Thomas. I'm the Medical Director for Healthcare Career Pathways from Kaiser Permanente, broadcasting live, recorded from my basement. And I'm here with a brother who I met in Tacoma, where I see patients. And I just was like, wow, good to see you, brother. I have no shame. As soon as I see a Black man in my hospital, I'm just like, we got to talk. So honored to have you, Richard. Please introduce yourself. Who are you and what do you do?
Well, appreciate you, Dr. Thomas. First, I'm gonna say my father would kill me if I didn't correct you in pronouncing my last name. It's Ekeke.
Ekeke.
Yes, E-K.
Thank you. Represent.
No worries. My name is Richard Ekeke. I'm from Houston, Texas. I'm Nigerian American, born here, but with heavy roots in Nigeria. I'm a travel nurse currently. I'm currently now in Tacoma, Washington, on assignment here where I met Dr. Thomas, who I will say, most of the time when like we're in spaces and we see other Black men, for the most we do it kind of acknowledge each other, but it's most like a masculine thing, like a what's up, like a head nod, maybe a fist pump. Maybe not so much because of COVID, but it's not really but you. I think I was charting and you came to around them patients, and the moment it wasn't even up to like maybe 5 seconds before you said, "How you doing, brother? My name is Dr. Thomas." Like actually introduce yourself. It kind of took me off guard because, like you said, most of the time, most Black men, we act like we're too tough, what I'm saying, to kind of identify. We're not that many in there, so we might as well kind of be familiar with each other. We're gonna be like working together, and I really did appreciate that, and it made it a lot real calm. Sometimes it be like a little bit the dynamic between doctor and nurse sometimes kind of can get somehow, But I actually did appreciate that. I did. That's it. Said you're a stand-up brother.
Thank you.
Back to myself. So I mean, travel nursing. I've been travel nursing about like a year and a half now. I've been nursing for 4 years, and I mean, as of right now, I'm just trying to collect as much experience and kind of see different sides of this country and the healthcare system, kind of how it works, and kind of I'm based out of Texas, but I'm bouncing around now, just kind of.
Yeah, tell me, where have you been going and what exactly are you doing? I saw you in med surg. Is that mostly what you're doing? But like, tell me more about the travel nursing experience you've had.
Yeah. Well, starting off with nursing in general, I started off, staff nursing like most other people. I was on neuro ortho floor in Austin because that's where I went to UT Austin for nursing school and my master's. After completing that right before COVID 2020, I moved back to Houston spring 2020, right when COVID hit. I got on a staff nursing job again at St. Luke's Medical Center in Houston on an orthopedic unit, but there was the goal more so to possibly see climb up the clinical ladder. But obviously those were kind of like slowed down, like those positions as far as coordinators, manager roles were kind of cut a lot when a lot of COVID cut a lot of positions in the hospital, and the need was mainly for the workforce nurses. So naturally, my sister tucked me into, start doing like local travel. So I was doing local assignments and like
Your sister's a nurse, or your sisters are what?
Oh yeah, sorry. My background, my father is a physician. He's now retired, 40 years, emergency medicine. My mother is a nurse, 30 years, everywhere from ICU to med surg, for 30 years. My younger sister is a nurse too. She's also a travel nurse as well. I'm a travel nurse. I have an older sister that's a pharmacist. Another one is a physician. And then others, they're not medical, like
you are truly a Wakandan, truly a Wakandan. You're gonna have to drop some vibranium on us here in America, man. Okay, so all of this experience, talk to it. Like, what is it? What is it to be a ortho versus neuro versus med surg nurse?
I mean, for the most part, nursing is, I feel nursing is nursing. There's a core base that you kind of learn as far as the skills and things to kind of know, to kind of guide your nursing mind. But then when you get to these different units, It's just like specific things that you kind of have to change, you know, how you would care for and the treatment for neurology patients, the orthopedic patients would be different than oncology patients and med surg, you know, like neuro was more so, it was more so like a med surg, but for the most part, you're mostly like ruling out whatever they're coming in as far as an altered mental status or some type of neuro deficit. You know, you can anywhere between a stroke to maybe like some type of encephalopathy from like maybe, you know, liver, kidney, you know, like you're deciding to. So like the clinical thinking was different with that floor. Ortho mainly was ambulation and pain management, you know, and fall prevention, you know, and to kind of get them to a spot that they can continue healing, you know, post-op. But as far med surge is for travel nursing has been kind of it's ambiguous because you might get signed on for a med surge position, but then you're in float pool. So now they're sending you to all types of unit. I think when I initially came back to Houston after I graduated, I was on the orthopedic unit, but that was beginning of COVID. So they shut down all elective surgeries. So now they've hired on these ortho nurses and there's no surgeries. So we were pushed into transplant units. So I got
Oh, wow.
on heart and lung transplant unit, learning how to work with LVADs, the medication, lab draws. It's not something that I expected to learn, but I'm grateful that I was able to be in position to kind of pick up that experience. And I can kind of say I've worked with these patients. I've dealt with this demographic of, you know, of nursing. As of now, like traveling, most of all my positions been most of med surge, but I've been everywhere between PCU units, trauma units, again, back to neuro units. Some of them are actually med surg units, but it just depends on the day, depends on the contract and staffing. The nursing kind of everywhere, staffing is kind of crap. But
Yeah.
I like it because I
You,
think in the end, it'll be beneficial for me in my career, my experience.
and so you mentioned everything from, I'll just tell our audience, LVAD, left ventricular assistant device. So that's
Yeah.
for heart patients to ambulating ortho patients to cancer to strokes to everything in between. So that just gives you a huge basis of experience. And then you've been dealing with COVID and the pandemic of racism. How do you deal with this kind of mixed up, crazy world just personally? There's a lot been going on.
I would like to say my support system is probably the best because I have, though you travel a lot, so it's kind of, not that it's hard to make friends, but at the same time, like I'm from Texas. Majority of my friends are still kind of based in Texas for the most part. So their lives and stuff kind of based in the place that they can probably more so see each other. I don't get the same privilege, more so because of my job. But the family and friends I do have, you know, and I talk to them on a very consistent basis. They can want to kind of keep me grounded, kind of keep me in perspective to not get too far off the deep end because it's not anything that you kind of can do. This is just the world we're living around us. And as far as like, you know, the pandemic in combination with racism, it's just, there's certain dynamics I think is kind of really funny, more so not just for nurses, but like I think for nurses of color and African-American nurses in particular. I can only speak for myself. I'm an African-American nurse. So like, I think some of the funniest things would be, especially during the height of the pandemic, right? Majority of our jobs were drawn to places that were really hit hard because of COVID. And I remember once, I halfway don't want to name the specific area.
Okay, but I think you can name the general geographies. I think it'd be
You
fine.
know
Yeah.
what? I would do it.
Yeah.
Woodlands, Houston. Woodlands, Houston.
Okay.
I was at
Okay.
a hospital there. I love the hospital. The hospital was beautiful, and it's nothing wrong with natural staff. It was the patient demographic. And this had to be sometime mid 2021. So they had a second surge that kind of hit that place pretty hard. And the craziest thing was, you know, seeing how many patients the hospital used to, and you can attest to this, how bad it used to get lined up the hallways. Patients that are like, you know, no isolation, just barely even have an oxygen tank, you know, or getting really messed up because, you know, complications with COVID. And, you know, we take history, stuff like that. And these are people that, you know, that they're against, you know, heavy against vaccinations, you know, heavy MAGA people. You know, you go to in these patients' room 24/7 and they keep Fox News and suffocations like that, you know, constantly going. And, you know, so I'll be lying to say it's not a struggle to kind of stay professional in situations like that because it's a lot to kind of be taking care of somebody that essentially I feel personally that's not doing all the, like the most that they can do to kind of help themselves. And then seeing kind of aspects of them that kind of tell a different picture of how they are outside of here. And we have to say, you have to treat all patients the same,
Right.
as, ethically. And I'm not to somebody that would condone, anything of that of sort, but you'll be lying to say that it's not hard, especially on demographic that you can personally identify with some of these issues and that like outside of your profession. A lot of them are, they're quiet, as far as whatever their views are. And especially I'm a 6'6" Black guy. So there's not too many crazy statements that would be said directly to me.
That was my next question too, is like, did people say anything crazy to you personally,
Oh, yes. I went to my last assignment and it was crazy. I was on the trauma floor. Patient came in. I only had him for about a couple of hours when he came from the ER, and he broke his femur, so he was waiting for surgery, and uncontrolled pain, trying to get him situated and comfortable and everything like that. And it's crazy because in such a hectic time and something you would think would be more so of his concern, he's asking me. It was the question he asked me, and he asked me first where I was from. I think I was in Austin at the time, and I was like, "Oh, I'm from Houston." He said, "Oh, okay. Well, what part of Houston?" I was, "Oh, southwest part of Houston." He said, "Okay." And then he continued on to kind of talk about demographic of Houston, hearing that that's a pretty hard part of Houston, and and I'm assuming he's thinking more so like hood areas. Like I said, I was my father's my mother's narrative. I grew up in Sugar Land, Texas. We weren't too far from the hood. We played around the hood and we went back. You know what I'm saying? So, and not that I'm not, out of touch, but that wasn't my upbringing. But the assumption was kind of, crazy. But you kind of let them talk because they was telling themselves. And the conversation kind of turned into, this assumption asking me what gang I was in.
Whoa.
This guy, and for more context, is crazy. Not only was femur broken, but we ended up finding out he had an aortic aneurysm because he had that we have found out probably an hour after. So there's a lot of stuff going on, and your priority in that moment is more so just make such a comment to somebody who is directly in charge of care and taking care of you. Any delay or any of that stuff on my end could mean your life. And let's say I wasn't somebody that's poised or somebody who grew up with morals and ethics, and that's a dangerous place. But it's baffling the comfortability to some patients, But again, that's just like one example of a bunch of others that you can kind of and I'm sure that everybody in my demographic and in that shoes can kind of have a story that's like that. That's some of the struggles, but maybe going back to my Nigerian upbringing, we're kind of raised to have a little bit more tougher skin. Not that every other people aren't, but I can speak for myself and those that I know in my family, so we can kind of get through. Like a lot of times that like I'd end up doing probably maybe on a break or at the end of my shift, because I was working nights, my younger sister works nights, my mother was working nights. We would all get off of work and call each other on three-way after post-op and just vent about our shifts,
Wow.
Then me, then Ijama will laugh about certain things, will give advice about how to handle certain things. Like when I say my system was, really solid, what I'm saying?
Yeah.
And I didn't have to leave my immediate family to do so, so I appreciate stuff like that. That keeps me going. It keeps me, steady, block out those distractions.
So I am curious about how it is that most people who are nurses are white women. How did you, you found your way into nursing basically because you had family. What would you recommend to people who have no such connection, and they're going in as a classroom, all white women or mostly white people, and you're a Black man or you're Latino or you're something that's very different than what they are? What recommendations would you give to that person?
I would first start off that you have to first believe that you belong there. That you are actually qualified to be there, and you have to believe it. Not that, just because you're here, it should be obvious. No, you have to believe it. So, because that's also going to be how you're going to speak up for yourself, defend yourself, and handle yourself in those settings when it goes to classroom, clinicals, hell, even when you get to the actual, practice, when you actually practice, when you get through nursing school, because a lot of times people are going to downgrade you. You know, it's just so many times we wear badges everywhere in hospitals, and I can tell you how many times, you know, people mistook me. Well, maybe more so because I was a man, that I either had to be a CNA or physical, something else that's not the nurse, the primary. I'm talking about even defer to the CNA while I'm in the room when we're both wearing badges that clearly show distinction between the two. So, and you have to take that on the chin, and you have to keep on going. But
Take
a
it on
lot
the chin, yeah.
because you can't tell, and on top of that, it used to be a flex sometimes, because once they find out you're a nurse, then they're inquisitive. So they start asking a bunch of questions, and you flex on them, because anything medical is not easy. You actually have to work to get to where you are. And for one reason, you should not ever let somebody diminish you and act as if you weren't not meant to be here. There was a story my dad told me when he was in med school, and he went to Howard undergrad when he first came from Nigeria in 1970. He actually didn't finish at Howard. He got early admission to med school, but while he was there, he was working as a janitor to in the lab, I guess the health science center, as he was working. And lo and behold, he said that he used to get, insulted all the time, especially that time, being an African immigrant, being a janitor. And after his journey, getting into med school, finishing med school, and now he returned back to Washington, D.C. for residency. And I guess, everybody in the hospital wears scrubs. He was walking through the lobby of some sort at one place, and there was a white woman that had flagged him down as he was rounding on patients and pointing at the floor, saying that she's been calling for 15 minutes for someone to come clean up this floor. And my father always knows his story, because she didn't look at him or anything about him, except for his skin color, and assumed that what his position, his worth was in that hospital. And he had to flex on her. He said, "Ma'am, I made too much money and went to school for too long to clean up your mess," and walks up. Right now, when you're little, it's like, all right, daddy, but there was a significance with that story, because somebody tried to diminish his value and his work. You can't do that, and I've never let anybody else, and none of my siblings, anybody else, ever do that to us, because you work like somebody insulting you in the hospital to, hey, you need to clean this floor, but you're a whole physician, so that's why.
So tell me, I want to get to kind of the how you get into nursing, but I still want to understand why you decided to. Now, I know you had family in it, but if people don't have family, why is it a good profession to go into?
Well, one, how I got into nursing, I originally was pre-med in undergrad, and decided to make a switch my senior year of college. But so I guess going back to Nigerian mindset, a lot of us, our mindset is not necessarily geared because of money, but it's more so financial stability. And yes, your goal, kind of how they teach us, your goal is to find something that you enjoy doing, but also can sustain you in whatever lifestyle you want to. Hence why a majority of us go into healthcare. I knew I wanted to be in healthcare. I love healthcare. I'm really good in sciences. I wasn't all the way sold on medicine. Personally, my father's a physician, so obviously that was an influence heavy there. But overall, they wanted me something that's going to make me happy and also be able to support myself. So I thought long and hard around that time. I tried out, different positions. Potential jobs. I was leaning heavy towards also possibly getting my MPH, maybe going to something like CDC or some of that sort. But I decided on nursing more so because at that time, this is probably 2015 or so. It was the stability and the room for growth. Now, I'm not saying there wasn't room, I'm talking about vertical growth. You can go from nursing, and then from that point on, go and get your master's, your doctorate in various fields. It's not even, at bedside anymore, but you're still connected with the patients and stuff of that nature. So I kind of lean towards that more so that, okay, well, at the very least, it wouldn't have hurt to kind of get the nursing degree. You could always go back and do something else. I was young, I was 23, 22, 23. So
Right.
lot of time. Like I said, lot of ball left, you know what I'm saying, as far as my
Right.
life, what I can do.
Right.
So but my actual, I'm gonna use a segue into how to get into nursing. My
Mhm.
actual program was different than most traditional programs. I was in the
Okay.
alternate entry MSN program. So
Okay, what is
basically,
that?
alternate entry MSN program is basically, traditionally you would let's say if you get your MSN, right, you would apply to some type of accredited nursing school, whether it be a ADN, which is associates, or a BSN program, and then go back to go get your master's. That's traditionally how people usually kind of climb up education-wise in nursing. Mine, it was a shortcut in a sense, or straight shot rather, straight to the MSN, as long as you have a your
Mm.
bachelor's in something else, because we're getting people from all different types of backgrounds, lawyers, teachers, engineers, uh,
Oh,
the
what?
architects. Yeah, that people that are looking for a total change of career into
Okay.
nursing. And by that time, most of them were like older, like maybe like 30s, 40s. They're not really trying to just do just bedside BSN nursing. Maybe they were trying to do something, you know, like elevate. So it
Right. Right.
provided the avenue to not only get your RN license, but then you can continue on to go straight into advanced practice. So it's like you're shot
Mm.
straight into higher up in that career as you want to. So I was just happened to be a younger guy. I was probably the
Okay.
second youngest in my cohort,
Okay.
joining the program. I was 23 when I joined. I mean, when I was accepted. And so my program was 1 year nursing school. You pass, take your board exam, become a nurse, hop straight into the master's. A year and a half to 2 years, you would finish your master's of nursing, depending on your specialty. Traditionally, what I would tell somebody who hasn't been in trying to get into nursing, traditionally you probably would go to some type of a university or maybe a community college to get your prereqs to apply to a nursing program.
Mhm.
Um, whether it be associate ADM program or a BSM program, you would apply. If you get in, school is school, you get, what I mean, pass all your
Mhm.
classes. And also once you finish that program, you can, you have your BSM, but you're not necessarily licensed until you pass your NCLEX, and then you actually
Right.
get to work. It's not that difficult of a process, but I
And the
would.
in class is like your licensing exam to,
Yes,
right.
exactly. Afterwards, because
Mhm.
people don't know, just because you graduate and you haven't paid
You
your
can
board,
work.
you're not working. Yeah, you're
Yeah.
not working. So you have to remember, it's like working after.
Right. And so most people do their associates, the bachelor, maybe their bachelor's, the in class, they work. You did a bachelor's in nursing still?
No. I
You said what?
undergrad, I did my bachelor. I got my bachelor's in biology, minor in chemistry,
Oh, I see. Got
and
it. Then you did a year of nursing school
yes,
because you already had from their bachelor's the prereqs. Then you went straight to the master's, and then and so now you're working, but you have the option because you have your master's to get into all kinds of leadership positions.
exactly. Yeah, it
What's
just
next
seems.
then?
Oh,
Oh,
what's
go
next?
ahead. Go ahead. Yeah,
No,
go ahead.
it was just at the time. I mean, obviously, I would want to actually use the master that I paid for, but
Yeah.
I mean, the time right now. I mean, travel is the most lucrative and most accessible job right now, and that's what kind of what I was. It's something to take advantage of as of right now. We never will
Yeah.
see a pandemic like we saw, at least the height of it. I don't think in our lifetime again. Hopefully,
Right. Hopefully.
knock
Yeah.
on wood, but but going to your question, about what you would do for somebody who doesn't have family in the healthcare, the nursing. The easiest way, honestly, most nurses are very, very nice, and they're very, very forthcoming with, like, advice and stuff like that. There's not too many you will find that won't talk. So if they don't know anybody, I mean, that's when you start networking, in a sense.
Mhm.
Somebody has to know somebody who at the very
Mhm.
least works in a hospital. If it's, I suggest some people, some of the best nurses started off as CNAs. I never did,
Mhm.
obviously, but I did notice that when I was in nursing school, some of them who kind of grasp a lot of the concepts and clinical skills that you learn in nursing school were the ones that already worked in the hospital as a CNA for however many
Oh,
years. And
yeah.
because you absorb so much just being in the atmosphere, and
Right.
it kind of clicks a lot better, especially when you're learning it in school, when like, oh, I've seen this for the past 4 years. I remember we had to do this for this type of patient.
Mhm.
So that would be a really, really big suggestion, especially somebody who wants to be sure, maybe they're interested in nursing, but they want to be sure this is what they want to do.
Yeah.
The outside of just talking and connecting with people, you know, that would probably be my best advice for them, you know, just so they know what they're getting themselves into.
Right. Well, we're short on time. I'm going to see if you have any last pieces of advice, and then I have one surprise question for you. I just been burning. I gotta ask, totally off the subject, but yeah, any last pieces of advice for people going into or considering healthcare, or yeah, just anything
Um,
would be good for our
I,
students to
I
know.
I would say that just know you're needed.
Mm,
And I'm gonna gear it away, if you don't mind, more so to Black health professionals, future health professionals.
yeah.
You're needed. Outside of the actual workers, yes, everybody's transcendent, but there's a certain perspective that we give to patients that I feel personally that is kind of unmatched in a sense. You
Mm,
know, representation matters in all aspects, especially in the hospital. People's lives are, you know, at stake here. You know, we kind of know some of the you know, what's the word I'm looking for? Downfalls of our healthcare system, especially when it comes to treating minorities, you know, and how they're, you know, treated pain wise, you know, health predicted outcomes, so those type of health disparities. And the way to change it is more representation. We need a lot more of
yeah,
those in the right places. So
yeah. Well, thank you so much. The last thing I just got to ask you is, are you a Toby Nwigwe fan? I can't
oh
think
yeah,
of
for sure.
I can't keep having I
And
can't say
his
his
name is,
whole name. It's
yeah,
like
his name
Toby
is
something
his name
something.
is Tobe Wigwe. Wigwe, the N is silent.
But then
Wigwe.
like his first name is like the
Tobe
real
Chuku.
first.
Yeah,
Yeah, yeah,
Tobe Chuku.
yeah.
Yeah. Yeah.
All right.
No, he's actually
Incredible.
from Houston. He's
And he's from Houston.
he's from
So
Houston. He from A-Leaf. He from that part. You know, yeah, he from there. You know, and he's Igbo and everything. But if you kind of know his story back in
yeah,
Houston and where he's come now, it's amazing. It's
yeah,
amazing.
yeah, yeah, yeah. He's doing some good stuff. Well, thank you so much. Thank you so much, Richard. We have some great information here, and um, all I can say is that I hope that you leave Houston behind and stay here permanently. But
Uh,
even if you go back, then we need to stay in touch. So I'm gonna stop the recording, and thank you so much, sir.
no problem, no problem.